Good afternoon. God, look at this crowd. This is great. Thanks very, very much for being here today. This is really very, very exciting. And judging by the size of the crowd, it's the issue that sparks this attendance and the willingness and the interest in knowing what in fact is going on with healthcare, but particularly with what we want to talk about today is healthcare and benefits for women. I want to just welcome my friends and my colleagues at New Haven, and that is obviously Speaker Pelosi and Congressman Larson. So I'm happy that they could be here with us today. Our first panelist is Dr. Carolyn Missouri, and although she speaks today as a private citizen, Dr. Missouri is Director of Women's Health Research at Yale University, an interdisciplinary research program which she created. She is a professor of psychiatry and psychology, associate dean for faculty affairs at the Yale School of Medicine, with a particular interest in gender-specific predictors of the illness onset and how to deal with treatment outcomes, and actually has been so focused on the issues that are so important to women's health. And we are so grateful for the good work that she has done. And of course, our second speaker is very, very special. My leader, John's leader, and our friend, the Speaker of the House of Representatives. And in so many areas, I will tell you, that's job creation, equal pay, clean energy, and now on healthcare. The Speaker has truly led the way in Washington for positive and transformative change. And when the health reforms become law, let me just say this to you very frankly, that when it becomes law, and it will become law, it will be because of the Speaker of the House, and it's because of an intellect, it's because of a strategic ability, a mastery of the legislation, a mastery of the political process, and of the legislative process. And you couple that with passion, dedication, and tireless effort. And you can't lose on this issue. So she's going to get the job done, and she's going to do it for all of us. You know, I had the opportunity in my career in the Congress. I sat with the Speaker and our colleague Nita Lowy on the Appropriations Committee, the subcommittee on labor, health, education, and human services. That's when we started working together on women's issues, and she is going to and is leading us on this eve of change and moving in a direction that will truly benefit women and women's health. Our neighbors in the 1st District being represented by Congressman Larson. Our third panelist, the Congressman, has been a key leader in our efforts to build reform in healthcare over the years. As chairman of our House Democratic Caucus, oftentimes the Speaker wants to know why she has 2 out of 8 people from Connecticut in the leadership. He has worked with the Speaker to forge consensus among our caucus members, and he has brought the same kind of conviction and that kind of getting things done spirit, not only to the healthcare fight, but all that he does and all that you know that he's done on behalf of this state when he served in the State House. So thank you so much, John, for being here. Really. What I essentially want to do is, I want to just give you 3 or 4 examples of how very, very real this problem of healthcare in women is. I'm going to tell you about a young woman named Celia, a woman who ran a bakery in East Haven. These are real stories. They're not made-up stories. She ran a bakery in East Haven with her mother and grandmother. Because they were self-employed, Celia's family could not afford private insurance. Celia's doctor did her annual gynecological exam for free to help her out. But Celia could never afford a mammogram, and so she never got one. One day, at the age of 50, she fell, she broke her arm, and was checked out. Doctors discovered that her bones had become brittle due to breast cancer, which had by then metastasized throughout her body. After 6 long, agonizing months of applications, She was finally able to get on Medicaid, but by then it was too late. Celia died at the age of 52 in horrible pain, all because she could not afford preventive care. To her credit, her gynecologist tried to do what she could to help pro bono, which is going above and beyond the call of duty, but that's not the way it should be. And speaking of going above and beyond the call of duty, another young woman in our community who went that extra mile for people in need, Laura Ryman, a teenager from nearby Wallingford. Her senior year, her Girl Scout project, Laura worked to find doctors to donate their time to treat low-income and uninsured people in their community who needed help. A woman who was uninsured, Nilsa, a young mother who had been diagnosed with ovarian cancer, who lived with a chronic kidney pain that she could not afford to treat. Lauren could not be here today because, true to form, she's helping to build homes for low-income families in Kentucky this weekend. But her good work casts a harsh light on the fundamental flaws within our system. In this day and age, the sick and the uninsured should not have to rely on guardian angels and Girl Scouts to receive adequate health care. Let me take the case of Jennifer, who's a patient of Dr. Eric Hodgson, who I believe is here. Thank you very much for your work. A Yale and maternal health specialist with us today. Jennifer is a young woman who works at a job that does not provide health insurance, and despite having gestational diabetes in her first pregnancy, she had a healthy first child. That left her at high risk for diabetes, and she could not afford to get the recommended follow-up tests. She became pregnant again. She learned not only that her new baby would have a major heart problem requiring multiple surgeries, but also that she was now a full-fledged diabetic. Her doctor believes that if she had insurance, she might have been able to control her diabetes before she became pregnant, reduced her chances of having a baby with birth defects. So in this case, Jennifer's lack of preventive care not only had a lasting effect on her, but likely on the health of her child. I don't know if Melissa is here.
I am.
Melissa. I met Melissa last night. Went to dinner with my family. She waited for me, and I asked her if I could say this today. And she said yes, I invited her to come. She waited for me, leaving the restaurant, and she said to me, "You've got to pass health care. I have cancer, and the pre-existing condition is killing me." Let me just tell you, the struggle, the tears in her eyes, that's what we're about trying to do for the people of this country and for the women of this country. That's what this is about. Thank you, Melissa, for being here today. Thank you. The stories that break the heart, and you know my history as an ovarian cancer survivor. They're personal to me. Countless other stories. We need to help women, all women in this country. The panel is going to tell us in detail the comprehensive approach to women's health care, the positive change it will make for America's women. And with that, you know, let me just say, it's about time that women's health care has been put on an equal footing with health care.
Thank you. Well, it's not easy to follow an introduction by Rosa, is it? I'm going to do my best. I want to say, first of all, that it is a real pleasure to be here as a member of this community. This community, in my experience, is genuinely concerned about the healthcare needs of this country and is clear in our understanding that the future of healthcare is an enormously important issue for women. And I also want to say that I'm very appreciative that we have the opportunity today, all of us here in this room, to have a conversation with legislative leaders who, by way of their actions and their accomplishments, have shown us a track record that demonstrates that they really value women and care about the health of women. As we consider, all of us, as we consider the importance of healthcare reform and how to reform healthcare, a central focus must be the fact that women in this country are the greatest utilizers of the healthcare system. And as we craft a healthcare plan for the future, we must do so understanding why women are the greatest consumers of healthcare. so that we can build a system that actually does respond to the healthcare needs of women. So why are women the greatest users of the healthcare system? Well, there are at least 3 important reasons worth mentioning today. First of all, reproductive health is essential to women's health. And reproductive health services unique to women are required in adolescence through early adulthood, through the reproductive years, as an investment in promoting long-term health. Furthermore, and importantly, unlike at the turn of the 20th century, when the average life expectancy for US women was roughly the same age as onset of menopause, women now live an average of over 30 years beyond the onset of menopause. Consequently, specialized health services for women do not end at age 50. Peri- and postmenopausal health care is needed throughout the lifespan, and investing in these services to keep us healthy, in turn, enhances functioning and reduces costs. Second reason why women are the greatest consumers of health care in this country. Women suffer from chronic disease and disability at higher rates than men, with dramatic consequences for our own health and for the health of our families. Women have higher rates of autoimmune disease, osteoporosis, depression, to name a few prevalent disorders. We also die at higher rates of heart attack, are now contracting HIV at greater rates, and are likely to have increased risk for lung cancer with the same smoking exposure as men. The scope of what is women's health goes beyond reproductive health. And our system of care must value women by including early intervention, ongoing and coordinated care, and prevention initiatives that stem the tide of suffering, some of which you've heard about today. Stem the tide of suffering and stem the tide of cost associated with conditions such as these that I've just mentioned. The third reason, women are at greater risk for repeat hospital and office visits because the health of women has not been adequately studied. Thus, we have not yet developed optimal gender-based treatments and prevention strategies that are needed to provide maximally effective care and reduce costs across many conditions, disorders, and syndromes suffered by women. Furthermore, when we have increased knowledge about women's health, translation to practice is slow. Even in considering cardiovascular disease, which affects 43 million US women, with estimated costs at $162 billion a year, where we have finally raised awareness that cardiovascular disease is the greatest killer of women, there is still a knowledge gap in recognizing the symptoms of heart attack and taking action. According to a recent University of Pennsylvania Medical School study, women with chest pain are less likely than their male counterparts to receive aspirin and other recommended therapies by emergency medical service personnel in ambulances en route to the hospital. In fact, among women in this study who had confirmed heart attack, none had received aspirin en route to the emergency room. There is a gap in our knowledge. There is a gap in the translation to practice. And finally, in speaking about how women's health is pivotal to healthcare reform, I would be remiss if I did not mention that we as women largely determine the healthcare for our families. 8 in 10 mothers take chief responsibility for choosing children's doctors, taking them to appointments, ensuring follow-up care. Many women manage their husband's or partner's health care. And over 1 in 10 women in this country care for a relative with a chronic illness. Therefore, ensuring the health of women indemnifies the health of our families. So as we craft our healthcare system of the future and consider how we can reduce the burden of disease on our population, and thus reduce costs, it is particularly important to consider comprehensive, coordinated, and continuous health care for women across the lifespan, informed by new research that can be translated to improve lives and the well-being of the entire population.
Dr. Missouri, we are so grateful that you're part of our community. Thank you very, very much. And now, obviously, it gives me great pleasure to introduce to you the Speaker of our House of Representatives, Nancy Pelosi.
Thank you all very much. Thank you all very much for being here today. Thank you, Rosa DeLauro, for your extraordinary leadership, on which I will dwell in a moment. I'm honored to be here with Rosa and with my colleague, John Larson. Yes, 5 members, right, in the House from Connecticut. 2 of them are in the leadership. They thought that was appropriate. Dr. Missouri is an icon in this country in terms of her leadership on women's health. What we just heard was really the dispositive statement on the relationship of academics and the personal impact in people's lives. It's a wonderful guide to us. But as always, while she has taught us for many years, we always learn something new from her. Dr. Missouri, thank you for your important role. And let me connect some things here. Rosa mentioned when we were on the Labor, Health, and Human Services Committee together, Rosa is there still making her mark in her leadership. And 3 of us were there, Rosa DeLauro, Anita Lowey of New York, and of course the 3 of us, there weren't any women, at least on the Democratic side, and then later a woman came from the Republican side and didn't necessarily share our view. But she's no longer in the Congress. But in any event, I think it's important for us to put today in the context of some of how we got here. Rosa came in there loaded for bear. The 3 areas, I know that surprises you. And all she talks about my persistence in this or that, you know where we get it all from. But she came in with her own personal experience, which she has shared with us. And these personal stories, Melissa, thank you for your generosity of spirit to be with us and to speak out for others in need of health care. She came in with her own personal story, driven by the knowledge that springs from what's happening here at the Women's Health Research at Yale University. And there were 3 areas in which we were trying to move forward in a groundbreaking way: prevention, care, and research. Each one of them very important, all of them seriously underfunded. This is for women's health issues. And Rosa knew exactly that we had to get $100 million for breast cancer research so that we could go into another. Once you got up to 100, then all kinds of other things set in. I mean, she had the roadmap all planned. But you have to remember that even then, which now I'm going back maybe like 15, 20 years, even then, just shortly before then, at the National Institutes of Health, they would not even use female mice. You've heard that story over and over again. But they didn't use female mice because, you know, what does that have to do with male health? Female mice had hormones, and that upset all of the research. And so, I mean, it's funny, it's then, but the fact is, that's what we were dealing with. And that wasn't that long ago. So again, in order to advance women's health in many categories, and some diseases where skeletal muscular diseases where women had more incidence, as Dr. Missouri said, as caregivers, just women are central, the hub to a healthier America. But nonetheless, when it came to health insurance, women were paying 50% more, in many cases 50% more than men for their health insurance. 50% more. Being a woman was considered, up until now, and we're going to get rid of it with this bill, was considered a pre-existing condition. If you were a young woman, you were of childbearing age, you have a pre-existing condition. If you could have children, I had 5 children. They said to me, I don't think we can renew your insurance. You've had 5 children. I thought I proved my health by doing it. They didn't see it that way. If you can have children, you have, and that's another. Then as time goes by, when you talk about, as time goes by, as it has, then other issues again emerge as pre-existing condition for women, including domestic violence. Can you imagine that being a victim of domestic violence is a pre-existing condition in the insurance world? So these, again, Rosa has told stories, and we all have them. I have a young woman who came to me who young, she was like in early 20s, and she said she started to work, she's bought a policy, low premium, high deductible. Never thought she would be sick. She only bought it in case she broke a leg skateboarding, she told me. And she is now, for the rest of her life, going to be paying off hundreds of thousands of dollars of doctor's bills because she got cancer along the way. Now, she is cured, or God willing, but she said, I work to pay my credit card bills, to pay off my health insurance. Hundreds of thousands of dollars in deductibles that she had. So it is, it's absolutely long overdue for us to do something transformational in this regard. But it is important to know that we have to end discrimination, as our bill does, based on gender and pre-existing conditions. As I said, women are charged nearly 50% more than men for the same coverage. With reform in place, it will be illegal for insurance companies to have gender ratings. Just to be specific, no one will be denied coverage or charge higher premiums because of a pre-existing condition. And by the way, that is in a Democratic bill, if I just may be allowed a partisan moment. It is not in the Republican bill. And that includes having a C-section as a pre-existing condition, or being, as I said, a victim of domestic violence. And it ensures coverage, treatment, and care that women need are affordable. If you're in half women, women obtain health insurance on the job. Nearly half of working women can obtain that on the job. And more than half of women reporting delay in needed care due to high cost, compared with 39% of men. Now we want men to have all this access as well. This is not a zero-sum game where we want it accessible universally. American women stand at the center of an effort, again, for quality, affordable health care. We have a list of reforms in the insurance industry. I repeat over and over again, no denial of coverage because of a pre-existing condition. There's a cap on what you pay in. There is not a cap on what you pay out, not annual, not lifetime. We have 2 pages of reforms that go on and on that apply to men and women alike, but are very important to women. I talked about younger women, childbearing age, and the rest, whether it's maternity, mammogram, a lifelong issue, or Medicare and Medicaid. A large percentage of people on Medicaid are women. And so with Medicare, for example, we closed the donut hole, the prescription drug and justice to seniors that was in the prescription drug. We closed the donut hole, and with the reductions that we make in Medicare, the cuts that we make in Medicare in waste, fraud, and abuse, we will maintain the solvency of Medicare. Don't let anybody tell you, oh, seniors are concerned. What does this mean, cuts in Medicare? It's not cuts in Medicare benefits or increasing in premiums. It's waste, fraud, and abuse. And unless we do that, we cannot keep Medicare solvent. This is very, very important. But the other side who oppose health care reform are trying to use that as a scare tactic. And again, on Medicaid, we want to make sure that people who are served in that community are served with quality care. So where we are going to be in a few weeks, and I don't know when, and I don't set any deadlines, and when my members come to their conclusion, we will take our vote. Right, John?
Yes. Exactly right.
John instructs us on this every day. But the road to where we are today started here. Started here with Dr. Missouri and her leadership on research, prevention, care, and the relationship of women to caregiving generally across the board, not just for women, manifested in a public policy way through many people whom she has affected, but in our case, particularly Rosa DeLauro, whose imprint, as far as women are concerned, is strongly on this legislation. Now we'll go to Q&A and take some of your questions on it, but I come here to thank you. Thank you for being a force for this kind of change, for women, for everyone in America, for a healthier country. Now you haven't heard about some of the things that are in the bill because all the controversy has had center stage. But this, Dr. Missouri, as you know, and because you've been a part of it, is about innovation. It's about thinking in fresh, different ways about how we have healthcare, a healthier America, not just healthcare, a healthier America, with a strong emphasis on prevention and not having to charge for preventive visits to encourage that. Prevention, wellness, innovation, and I know Rosa's just chomping at the bit to tell you some of the nutritional and some of the issues that are in there about nutrition. Because this is about making America healthy, and it's also in doing it in a way that says to all Americans, healthcare in our country is a right, not a privilege, and this legislation will ensure that that is the case. So, relentless as Rosa is on everything that she is interested in, but she gives priority to these women's health issues and anything that relates to family and children. John Larson so too is, but his relentlessness is on how to get the job done, whether through new technologies and recognition of the public-private role, and he is as much of a pest in certain for the good, for the better. Relentless. How many times has he stopped the meeting and said, once again, I want to tell you about how the public is better served if we make all of this available to all Americans. He is a great leader in the Congress, and I want to thank him for his insistence that, not only in this bill, but leading up to the bill. A year ago, when we passed the American Reinvestment and Recovery Act, John was insistent that we had investments in health IT. It's so important, and they'll talk about it, so important, and it's going to save money, improve quality as it expands access. At that same time in that bill, Rosa was insistent that we had more funding for the National Institutes of Health. So we have a running start on this bill in terms of science and technology from the bill that was passed last year. So when this is passed, it will be built on a foundation. 11 million children in health insurance last year as part of, again, our running start on a healthy America. But I just wanted to comment on what a great leader John Larson has been in this and so many other subjects as well.
Thank you, Madam Speaker. You know, you listen to the speaker, you listen to the intensity of her whole being, and it's a moral compass that she has with regard to this issue of making it happen and her understanding of how critical it is. So it's full steam ahead, and no one gets it better than Nancy Pelosi. And let me just say, serving with John Larson, we now have become where we look at each other, we just, I can start a sentence, he can end it, he can do the same for me. So what a friend, and in an institution, and the speaker can attest to that, where you make few friends, a lot of acquaintances. John Larson is a great friend. He's a great friend to all of you and to this state. He did that, as I said, in the State House, and he's taken that leadership to the Congress, and he is an outstanding chair of our Democratic caucus. John?
I get this sense, I have a feel, do you remember George Goebel? Yeah. He had a famous saying, after listening to Rosa with her energy and conviction, and then the incredible speech by Dr. Missouri, and then to follow the Speaker of the House. I feel like a brown pair of shoes at a black tuxedo event. So, but indeed, indeed, which is exactly what Goebel said, but indeed I'm honored to be here with my colleague, Rosa DeLauro, who energy, her capacity to do such extraordinary work on behalf of people stems, as they say, the apple never falls far from the tree from her mother. And her tremendous devotion to everyday people, but specifically to the cause of women. And her energy, she was the dean of our delegation from Connecticut and our leader as well. Dr. Missouri, let me say that I think you said it, as Rosa pointed out, succinctly and clearly. I want to tell you what we're up against, though, and why I think when you leave this room, you'll have more than an extraordinary appreciation for the Speaker of the House. We are up against, well, it's great to be a part of history. And as Rosa said, we are going to pass this bill. And the reason that we are going to pass this bill is because of our leadership. That's why that's the bill of the Speaker of the House. Why so? Because this historic moment, not unlike Roosevelt and Social Security or Johnson in Medicare, the time has come. And we are this close. But this bill has been on life support on more than one occasion by those who would like to defeat this piece of legislation. And what have they chosen as their target for this legislation? They vilify the Speaker of the House. The Just Say No crowd vilifies the Speaker of the House. Because as Frank Luntz pointed out, if we stop health care, we stop Obama. Wouldn't you think that in this day and age that we would be thinking about doing what's best for the American people? And stopping health care stops the progress of the American people, and certainly what you've heard today and what you'll come away with, what a setback it would be for women all across this country. These are great leaders, and more often than not in our own country, you don't recognize it. Almost a year ago, today actually was February 21st, I was in Afghanistan with Rosa, with Anna Eshoo, the sixth member of our delegation, and the Speaker of the House. She's from New Britain, Connecticut, though she's in the adjoining district in California to the Speaker. And we had a meeting that was set up by a friend of the Speaker's, Heidi Kuhn, who is, I believe, heads up an organization called Roots for Peace. And we were meeting with 4 women from Afghanistan, 2 in burqas, 2 not. One of them, as I recall, Dr. Mazuda Jalal. She had run for president of Afghanistan in 2004. For whatever the reason, I had gotten to the room along with other members of the delegation before the Speaker and Rosa and Anna. And when they walked into the room, to see the look of hope and pride on the faces of these women was just incredible. And the humility of the Speaker and Rosa and Anna when they came in, and it was as though the breath was taken away of these other women to see the third most powerful person in the free world and 2 chairs. 2 chairs, that is the truth. And 2 chairs of such important committees on intelligence and appropriations. And the first thing they said to us is, thank you so much for passing Lilly Ledbetter legislation. Now remember, we're in Afghanistan, in my own district. I would be grateful if people, in fact, knew how important that moment was. And with their eyes welled up, they greeted the speaker and Rosa. It's about equity. That happened to be pay equity. Dr. Missouri, Rosa, and the speaker have laid out what this is all about. I am surprised, in many respects, that women haven't already taken to the ramparts. I spoke to, and I speak to insurance companies all the time about this. When you look at the list of pre-existing conditions, and as the speaker has already outlined this, rise up. We need your support. We need to push back against the forces that just want to say no. That think that perhaps by putting another Band-Aid on the problems that this nation faces, well, that will somehow gloss over the extraordinary need that people face. And so, we're here today with the speaker and with Rosa, and let me assure you, our caucus, which has accomplished the entire president's agenda, under the leadership of Nancy Pelosi, would-be her male counterparts in the United States Senate would handle the more than 290 bills that we have sitting there. We would be even more pleased. But they are, in fact, up against a group that wants to stop this at all costs. We're here to make sure it happens. And under the leadership of our great speaker, it indeed will. Thank you. Now your questions.
Thank you, Don. I want to thank our panelists. I believe you did get a handout, which comes from the Speaker's office, which identifies all the areas that are covered. And with that, the floor is yours. I think there is I would ask you just to get up and to identify yourself and then go forward. Pat, go ahead.
I just want to thank you so much. I just want to thank you for being here, knowing the microphone. Thank you. I represent people who know more about what is not in that bill than they know what is in that bill. Some of my issues in my own district come from the left of the Democratic Party. If a pollster called them up and asked them if they supported the bill, they might say no. And I am so thrilled that you are here, because the issue of pre-existing conditions should be non-negotiable. And folks need to understand, it's not just about whether or not you live. It affects whether or not you can work.
Thank you, Pat. Thank you. I'm going to come to, let's go here, we'll go over that.
Thank you for being here. My name is Gail Katasha. I'm the Regional Director of Connecticut Community Care. We care for 10,000 elders on the Connecticut Home Care Program for Elders. I'm also the co-chair of the Connecticut Women's Health Campaign through PCSW. Long-term care is certainly a woman's issue. You've said that succinctly. 500,000 people in Connecticut are over 65, and 60% of those are women. Women provide the care, the informal support you talked about. They do the paid care for minimum wage. They also need the care. My question is, could one of you address how health care reform may impact long-term care issues, for which I'm keenly interested?
Well, Rosa, why don't you have a
Well, you know, what we're trying to do is to start that process. I think you make a very good, very, very good case, and the issue is that, in fact, women outlive men. That's a statistic, right, Dr. Missouri? And sorry, gentlemen, what can I tell you? But what we're trying to do is, at the beginning, to try to address this issue for long-term care with an investment and a beginning investment, the opportunity to be able to provide long-term care for seniors. That, in fact, is in the legislation. It's a beginning. It's not definitive. We couldn't go the full, just to try to do it all. But we are very, very much focused on that and very supportive of it.
And as Rosa, I don't know if you want to mention the Class Act. There's something called the Class Act. I can't remember what the CLASS means. I usually know, but I don't remember what this meant. That's an acronym, and it is a model for how we can go forward on long-term health care. But as you say, it is it's not only a health issue, it's an economic issue for all of America's families, not only for the seniors, but for their children and grandchildren as well. So thank you for what you do. Also, it's important, I didn't say anything about people with disabilities, and the Class Act is largely focused there. People with disabilities, and disabilities are everything. Diabetes, cancer, a diagnosis is a disability, a pre-existing condition, and it just goes well beyond any immobility and the rest in terms of disabilities. And this bill is so important. That's why the other day in my office I had every kind of coalition that you could put together for people with disabilities coming in to say, we must get this bill passed now. Because again, no cap on what you receive and no cap in a year or in a lifetime. And I might said also we have mental health parity in there as well.
I would just like to add that, again, to tell you what we're up against, and I would say to my good friend Pat Dillon, remember, let's not make the perfect become the enemy of the good. But this struggle is deep and severe. There is a lot at stake here, and we have to make sure, we have to double down to make sure that we pass this. Now, our colleagues on the other side, they've had some pretty clear examples, as they point out in their bill, and Paul Ryan, a very good and constructive member of the Ways and Means Committee, who I couldn't disagree with, but at least he's laid out what their plan is: to voucher Medicare, to privatize Social Security, to block grant Medicaid, and to ultimately treat all health benefits given by employers as ordinary income. It should be an eye-opener, but instead, I think, as Pat points out, everybody is concentrated on what's not in the bill, and the fear that's been generated around this bill is palpable. And so I think that's all the more important why we have to get this first step, get it done, move on, and then move forward and correct this on behalf of all Americans.
Thank you guys for definitely speaking up, but I just wanted to share with everybody why this bill is so important to me. 2.5 years ago, I was diagnosed with a stage 4 lung cancer. I'm a non-smoker, and it had metastasized to my brain. They gave me 6 months to live, and it's been 2.5 years, so I started at a job I started a job after college, and I'm still at that job. It's not a job I wanted to stay at forever, but now because of this, and I know I can't get coverage from another company, because of my pre-existing condition, I still have to stay at that same job with the fear that if I lose that job, I'm going to lose my health coverage. And my bills alone, without health coverage right now, are about $1 million a year. So not only do I have that worry constantly of fighting cancer, but I also have the worry that I might not be able to afford it someday. And that's exactly why this is so important to me.
I'd like to make one point on that, Rosa. Melissa, thank you for your courage, your bravery, and again, sharing your story with us. Melissa makes a very wise point, and sometimes you see this point made in the paper. Think of an economy where people did not have to be job locked, that they could follow their aspirations. They could become a photographer or a painter or a musician and be self-employed, or they could start a business, or they could change jobs, but they are job locked because they have a pre-existing condition. A child may be bipolar, there may be a diabetes diagnosis, and the list goes on. It's what affects many, many people in our country. And we're competing with countries where this is not an issue. This is not an issue. So we have every compassionate reason, as Senator Kennedy said, this is about the character of our country, a right, not a privilege. But it's also, we can't afford the status quo because it's unaffordable to individuals, to businesses, to our budget, but it's also unaffordable to our economy in terms of the price we pay for curbing the aspirations of our people to do their very best because they are job locked. That does not honor the values and vows of our founders about the greatness of our country. So thank you, Melissa, for making that fine point as well.
I just want to say that just in terms of the specifics, so that you think we're just not talking here, that there will be funds provided immediately for support of a program to provide affordable coverage to uninsured Americans with pre-existing conditions. This will be enacted 90 days after the passage of the bill. Coverage exclusion for children, which is an immediate benefit. Some people say, well, it's 10 years from now. No, it's now. We're going. Right, no, Tony, let me just, the woman behind you had her hand up. Let me go to you there. I don't want to get back to you. Sorry, Tony. I smile.
Welcome. I'm Judy Tabar. I'm the President and CEO of Planned Parenthood of Southern New England, and we serve 62,000 patients in the state of Connecticut. 90% of the people who come to us come for preventive care, and we are thrilled about healthcare reform and all of your hard work. You've talked a lot about equity, except for one service, and that is abortion care. And I'd like to hear from you how you imagine we are going to navigate through this so women don't lose benefits they already have. 2/3 of the patients who come to us for abortion care currently have insurance coverage. And the way it's going, it looks like that is going to go away. This week we've heard all over the news, STUPAC is bound and determined to have STUPAC language in this bill. Can you speak to the future of abortion coverage? Sure.
First of all, thank you. Thank you for your leadership, Jean, and for your question. 3 principles. 1, federal funding of abortion is prohibited. That is the law, and this bill does not provide federal funding for abortion. Don't let anyone tell you anything different. Second of all, we will not have any diminishment of access. There will be an expansion, but there won't be a lessening of access. So if we agree that those 2 principles should be where we go with this bill, that's where we are. And if you further agree that we should have health care reform, then you shouldn't have any problem. If in fact you want to hold up health care reform, you can make any representation you want. But the facts are, there is no federal funding of abortion in this bill, and there is no reduction or increase in access to abortion in this bill. We cannot have a bill with a STUPAC amendment in it. It's just not going to happen. Because that would violate that second principle. That would violate that second principle.
Tony?
I want to thank you all for all your work.
State Representative.
We need your help so that we can follow in your footsteps in reaching the community and talking to the people. I am so tired of turning on the TV and hearing people say, this is what the American people want. I'm one of those people, and I want this health care, but we need your help in trying to get people to understand it is not an issue about changing what we've done. It's about pushing forward and making sure that we get it. So if you have pollsters out there that can help us in presenting it, if you've got facts and issues, we need you to help us do that, especially on a state level, because we hear it over and over again from the people on the other side saying, this is not what the American people want. This is not what the American people want. We need your help in trying to push this through. So whatever you can do for us to help us push this through, we would really appreciate it.
Talk about that at the end. So no more questions.
Yes.
I'm Mary Leah with the Alliance for Retired Americans. You mentioned, don't let people tell you that the older people are not in favor of this bill, and I'm here to tell you exactly we are not. We are in favor of it.
I'm sorry, what has happened, I mean, our organization and the members that are active in our organization were thrilled at the bill that was passed by the House. We were very happy with the pieces that helped preserve Medicare and expand the services for members. I'm from an organization where I don't think I have a member that doesn't have a pre-existing condition. In the Alliance for Retired Americans, we all do, so we're extremely happy that that is being handled in the bill that is still there with you. We're hoping that you've had the courage so far to fight for a bill that was excellent for not only retirees, but all Americans. And we hope that you'll continue to have the courage, even though there is so much out there. And I'm most frustrated because it's my members, it's the elderly that have been targeted by what I see as a very well-financed and very well-orchestrated opposition that would like to see this be defeated. And they are becoming very much afraid of what is going to happen to their Medicare. I'm trying to tell them they should be afraid if you don't pass this bill, because this is what's the key to preserving the Medicare that they have been used to having. But it's just, we don't have, it's hard for us to get to all of our members. We don't have radio stations that will play us hour upon hour upon hour, or on a television station that will just simply try to diminish the job that you have done. And as John Larson said, go after you and after our president. So we're hoping, we know it's taken a lot of courage to go this far, and we're hoping that you will do whatever it takes to get this over the line. And we know that there's going to be a lot of opposition. We have to go to reconciliation, but if that's what we need to do, we need this bill. All of us, the retirees and everyone else, we need this bill.
Thank you. Thank you. Thank you to the Alliance for Retired Americans.
My name is Susie Voigt, and locally I'm the chairperson of the New Haven Democrats here in New Haven. And we all know I'm really echoing Tony here. I guess I want to know what I can do and what I can ask the members of the New Haven Democratic Town Committee, and I see some fellow Democratic co-chairmen in the audience, Jerry Weiner. What can we do, this week, next week, and the coming weeks, so that the members of my town committee who are meeting and having conventions can get up and stand up behind health care? Thank you.
We have a young lady right there.
Hi, good afternoon. Thank you so much. It's really an honor for me to be here as a part of this. My name is Marie Rose, and I coordinate the Breast and Cervical Cancer Early Detection Program out of a community health center in Middletown. And just this past week, I had 2 women that were diagnosed with breast cancer. One of those women was screened through the program, 32 years old, from Africa, actually. And the other woman, I did not meet her until she was at a point of diagnosis, admitted to the hospital with invasive breast cancer that has spread so severely to her lung that it was partially collapsed, and she had trouble breathing. She actually went into a walk-in clinic to get services. She had not seen a physician in over 20 years. She did not know about the community health center. She did not know about the services provided to her. The only answer she could give me for that was, I don't have any money, I don't have any insurance, and it's too hard. Our program is only available, well, we do outreach, but the education is primarily available at those provider sites, those physician offices. So if there's no insurance, these women are not going to go. They're not going to get the coverage and the basic screenings, mammography especially, that they need. My question following that is, we do provide services to women who are undocumented. And the breast and cervical cancer early detection program allows those women to be screened through the program. Our community health center welcomes those women. What consideration, if any, will be made in this reform to include those women to receive services and financial coverage for treatment?
I think it would be useful at this time to, Rosa, do you want to take another question?
I wanted to ask you one more hand. I just, and if I may just say this with regard to cervical cancer, that's a very, your issue is very taken. I'm not going to sugarcoat it. They will not. They will not. And let me just tell you, in passage of this bill, we would not be able to pass it. So that is reality. And I will just say this to you on cervical cancer. Takes, I think, and I've got so many medical people here today, I get a little concerned I'm going to say the wrong thing, that there are about 4,000 women who die every year from cervical cancer. We now have vaccine, we now have a way in which we can deal with prevention. One of the biggest issues is on the screening and being able to afford the screening. And so that people who again, we're not addressing the issue that you brought up, but the fact of the matter is that the bill would provide for the wherewithal in terms of screenings for cervical cancer. So Emily, we're going to do this, make it the last one because we got to go to press questions and then do somewhere else.
I'll make this quick. My name is Dr. Emily Fine, and I'm a gynecologist, having been in the trenches for about 26, 27 years. So I've dealt with all of these issues for a very long time. But my concern here is with this bill is without the public option, I'm sorry it did have to be said today, my concern is having dealt with the nightmare of medical insurance for my entire professional life. Once healthcare is mandated, I am really concerned that basically this is just going to be, the best day in the life of the medical insurance companies. And I want to know what you're going to do to make sure that without the public option, and I'm hoping the public option is still a possibility, that we can control the private insurance companies.
My colleagues in the leadership, they don't like when I stand up. It's a signal. Because I can't contain myself sitting down on some of the challenges that you all so appropriately bring forth. First, let me just thank you all for what you do in the community to make America healthier. We're all in your debt from that. And we learn from you on it because you're on the front line. And maybe if I can just put what we're trying to do in perspective. Think of it this way. I say to my colleagues, the most privileged person in America, with all the wealth and opportunity and knowledge and access, will have better health care if the poorest person in America has access to health care. If we're all in a common record, and that's why the technology of the electronic medical records is so important. Teaching hospitals teach in places where they can learn from a wide array of diagnoses, and it benefits our entire healthcare system. Having access through the community health centers, which is a very important part of what we do. We have a large increase in funding in community health centers in the legislation because they have been the first line of defense in many cases for people to have access short of just going to an emergency room when they have absolutely no other recourse. So we're thinking not to think that this is a trickle-down thing, but to say the wave of the future comes from the people. Many more people treated, many more people healthier, much more prevention as Dr. Missouri said, early intervention. So how we put this bill together was to say, how do we, again, I give it a AAA rating, how do we improve access, increase affordability for many more people, especially in the middle class who might not fall into some subsidies or whatever, and hold the insurance companies accountable. Left to their own devices, they have done great harm to the health of America. We thought, let me just, today was today, the 6th of March, yesterday was the 5th, that's March 5th of a year ago. Because yesterday I was making a speech in Boston, not this, but I was using these bookends. March 5th, 2009, President Barack Obama called a bipartisan meeting to the White House in the East Room. Democrats and Republicans, House and Senate. Stakeholders from outside, everybody, pharmaceutical industry, health insurance industry, community health centers, children's health experts, women's health, you name it, every possible manifestation of health care and public policy was present in the room. The president reached out and said, we want to work together in a bipartisan way to get this done. Senator Grassley stood up, the Republican lead, ranking member from Iowa, and he said, he questioned the public option. President Obama said, public option, in my view, is the best way to hold the insurance companies accountable, to increase competition, and make it better for the consumer. If you have another way of doing it, put it on the table. The American people know what the doctor told us. If you're mandated to have health care, don't throw me to the wolves of the insurance companies. Give me some other option. Well, as you know, the insurance company weighed in, and you know it locally, weighed in on this in a way that prevented 60 votes in the Senate from getting that public option. But we were determined that we would get as much as we could that a public option could achieve, because it wasn't about the ideology of that particular tool. It was about what it would achieve for affordability, access, and holding the insurance companies accountable. We went to an idea that had been espoused by Republicans. The exchange. Olympia Snowe was one of the co-sponsors of, co-authors of legislation. Senator Enzi, the ranking Republican on the Health Committee, that's one of the committees that wrote this bill in the Senate, espoused that. So for 1 year, now we have the bookend. Last week, on that last Thursday, when the president again called Democrats and Republicans together to talk about any ideas they might have to improve the legislation as it went forward. So let's dispel one of these things, that this has not been open to ideas. For the year in between, far too long in my view, the Republicans have had their chance, or those who oppose health care have had their chance to put their ideas on the table on how they would serve the American people. What we saw then was that there weren't many ideas, but the president was still open and receptive, much more patient than some of us on that score, to some ideas they had about improving the exchanges or removing more waste, fraud, and abuse, and dealing with some issues. Actually, one good idea emerged. One good idea emerged from there. And something we had been fighting for, but it helped us, which was to make Medicaid docs, have primary care docs for Medicaid be paid the same as Medicare doctors.
Right.
We have been fighting for that, but again, in the competition for the dollar, there's decisions that were made that said we may have to wait for later for that, but now we will have some of that. We had some, and now we have a little more. My whole point is, there's enough already with waiting for another view of the world. You are either for, and I think what emerged from last week's meeting was, you are either for regulating the insurance companies or you are not. And you either are for eliminating the denial of coverage on the basis of pre-existing conditions, and you are not. That's the most obvious manifestation of reforming the insurance industry. So here we are, being for 1 year, trying to find bipartisanship and being criticized that the bill is not bipartisan enough. For 1 year, having other people characterize a bill because there isn't a final bill, and there will be in a matter of days or hours, that people could call it anything they want. It has this, it has that. I mean, it's unbelievable, the mythology that exists about what this is. But what it is a bill about innovation, prevention, wellness, a healthier America, affordability, access for the middle class, accessibility for tens of millions more Americans. It's a job creator, 4 million jobs. This bill alone, not counting all the jobs that John has in the health IT and the rest of it. So when you ask, what can you do to help and how can we dispel much of what is out there? When you do something like this, I mean, we all fought very hard for the public option. We kept it alive as long as we could. Then when it came down to 51 votes, we thought our prospects are even better now. But that is not the case. Under the up or down vote, so I go into majority rule, the constitutional majority, and the reverence, the enshrinement that we have for majority rule in our country. Do these senators want to have to be elected by 60% of the vote? So again, the fear-mongering to our seniors. By the way, they have suggested these waste, fraud, and abuse cuts themselves. They have to happen. But now they have suggested counseling, end-of-life counseling, or even I want to have it now myself. I'm hoping I'm not very glad, but you never know. You never know. But you're mischaracterizing all of that. So in another short period of time, a matter of days, we will have a bill. And once you have a bill, then you can say, it isn't in there, it isn't. Well, we say that now, but of course, until they see it on the internet, which I think will be imminent. And when we do, we need everyone who cares about this issue, cares about fiscal soundness for our country. I mean, even if everybody had great health care in America and wonderful insurance, we cannot afford the status quo, but you know that they don't. So we have health reasons why we have to do it. We have budgetary reasons why we have to do it. We have competitiveness reasons why we have to do it for our economy. So we will be, again, discreetly today we are talking, our focus has been on women, it's on seniors, it's on young people here in New Haven. Stay on your policy until you're 26, your parents' policy until you're 26 years old, giving young people a healthy start as they go out into the world. So again, we will have the drumbeat. Better quality, more affordable to many more people in our country. And again, we will have a statement of what this bill is so that those who want to mischaracterize it, now they will mischaracterize it because no matter what the poster is, it could be pro-life, it could be whatever, socialism, it could be this, it could be that. Underneath it all, peel it off, it's the insurance companies. They've had it all their way. We've been playing on their field for generations, and now it's time to play on the field of the American consumer. I just want to say something about how proud I am about my members. Rosa and John and others, some of our new members, Congressman Piriello of Virginia, Congressman Markey of Colorado, freshman members. Louise Slaughter of New York has been working on the issue for, I think, decades. Passed a bill on the floor of the House last week that ended the exemption from the antitrust laws for the insurance.
Yes.
406 to 19. The leader of the Republican Party of the Congress voted against the bill, but nonetheless, 406 to 19. So again, we put down a marker. This bill will not be the last bill you will be hearing from. We do have to address long-term health issues. We do have to address documentation, because it's healthier for America for everyone to be in the loop. It cannot be, all of it cannot be done in this bill. It is made, Rosa, if you give me another moment. When Social Security, Congress, everybody gets an assigned time, except the speaker can speak as long as no time limit. No time limit. I'm reading this book about Frances Perkins, the woman behind Social Security, and what a fight that was at the time. And again, the same people who were opposing that change, that sense of obligation from one person to the next, well, they're still with us. But in Social Security, when it first passed, the left was unhappy because they had another plan, something called the Townsend Plan. And it was not sustainable, but it was what they had wanted. And some people lost their election from the left, because the left defeated them because they didn't go with that plan, which again was not sustainable, but it was a good idea, I suppose. But it was not as good an idea of social. We're not just helping the poor, but it was a compact with everyone in America, so you could sustain a constituency for it. That's why you can't means test Social Security. Sometimes people suggest it's about everybody paying in, coming out, and not somebody doing a favor for anybody else. But it didn't cover teachers, people who worked in homes. Sounds like women to me. Farmers. It didn't include a lot of people, but then it did. So you have to start. You have to kick open the door. And as I said to members, I understand that sometimes you want to vote against a bill for what it isn't, but we want you to vote for this for what it is and what it can lead to. And we all share that value of a sense of community in our country, our responsibility to each other, again, a right, not a privilege. We're all healthier if everyone is healthier. And again, all roads lead from New Haven and